So for me, as the Executive Director of UNAIDS, I am very scared about that one. I'm scared because also when we are going through this all change, when the world is asking us to almost normalize the fight against HIV/AIDS, what I am saying, unfortunately, instead universal access for most at-risk population, what I am saying is universal obstacles. 80 countries with homophobic laws in the world today. 10 of them having even a death sentence for someone who has a different sexual orientation. We have developed part of the world like Eastern Europe, Central Asia, with a huge opportunity to stop completely the epidemic, but still continuing to have laws which are making drug users criminal. Most of them hiding themselves. More than 70% of the new infection occurring there are happening amongst those people who use drugs. I just said that makes me scared. That is at the same time a moment where we can completely say we have been having all opportunity to change the fight against HIV/AIDS, and that's what we are seeing is a prejudice, is a growing stigma, is a criminalization with a different type of law which are not just acceptable. I want just to say again, if you want, that it should not stop us. The only things which must continue to make us believing that what we are doing is important is what is happening amongst those voiceless. For me, it's so beautiful when I am in Abuja, in the hospital, when I'm meeting someone who told me, 10 years ago, I was dying. I was on my deathbed, and with less than 20 CD4. And today, look at me. I am a peer educator. I am contributing to the social change in my country. And I'm married. I have 2 kids who are HIV negative. That is the face we need to keep. Because that face is the face of hope. That face is a true victory against adversity. And I want you to continue to think about those people who will not have a chance to meet, but those people who truly believe that we are making a difference. That's why I think we must recover, our sense of outrage. I think we need to not accept that the world will continue to have 7,000 new infections every day. I think it is for that reason, in Vienna, I call for reshaping completely our AIDS response. And I think this process of reshaping should begin with a new vision. I know many people will say, again, Michel, if you know him, he's a dreamer. But it's true, I am a dreamer. I was going to school without shoes. And, all the people around me were not having shoes. When my mom was putting the shoes, I was taking that out and I was putting in my bag. When I was coming back home, I was putting my shoes. And my mom was saying to my dad, this boy is so nice, his shoes is always clean. But, today I'm Executive Director of UNAIDS. And if it was not the dream, how If it was not a better redistribution of opportunity, how? If it was not certainly a luck and a social justice somewhere, how? And that's why I believe on the vision of a zero new infection. We need to go for zero new infection. I don't see tomorrow morning it will happen, but it will happen. We need to go for a zero discrimination. Society which are built on exclusion is not sustainable. We need to go for inclusive society. And that means zero discrimination. We need to accept that it's possible to have zero death due to AIDS. We are seeing already, like I said, zero new infection happening with a mother-to-child transmission in many parts of the world. Zero new infection. Babies born without HIV. And it's possible. Let us make this a dream a reality. And that is the vision which I want all of you to help us to deliver on it. Because we want nothing else than that one. We want that because zero, from my point of view, requires a few things. First is a paradigm shift in our way to do the work. First is to bring the prevention revolution, making prevention our motto, making sure that this prevention revolution is built around three pillars. First is our young people. You have 1.2 billion adolescents today. What are you telling them? We remember, few years ago, infections was amongst MSM at the beginning, and they were the one who have been able to demonstrate that we can go to scale with a prevention program. And today, it went full circle. Again, infection is growing. Even in your own country, it's growing amongst those groups. In US, in different parts of the world. Because if we ignore this 1.2 billion adolescents, if you think that they don't need sexuality education, they don't need to have access to universal sexuality education, which will not deny them from understanding that you have a different sexual orientation, which will not deny them to understand that some people are using drugs, which will not deny them to understand that sex workers are there, which will not make them feeling that the world is different than what it is. I think you will miss completely to create an opportunity to equip them with a skill, with a knowledge, which will make them actors of change, which will make them also capable to negotiate their sexuality themselves. And that is not happening just because you have a PhD. I remember being in Uganda, UNICEF representative, and one of my policy advisors, she was a PhD. She came to me, she was crying, and she told me, I know that my husband is positive. And I know that he will never accept that he's positive. But I still have sex without protection with my husband. I cannot divorce. I cannot ask him to protect at least myself, because in my society I'm seen as a good couple. Very respected one. I have a big kids. Thanks God they are not positive. And this lady, probably in the end of the road, she's also positive now. What we are seeing is a growing infection amongst stable partnership couples, Most of them, more than 40% in some part of the world, most of them become discordant couples. The husband is positive and the wife is not. So for me, it's important to equip young people with skills. It's not a diploma. Diploma could not help her to negotiate her sexuality differently. And it's impossible. You could have all the PhD in the world. And that's why young people need to be in the center. The second pillar for me is gender inequity. It's important to reflect on the role of the women in the society, to look at and to just think about what Chinese are saying. If they are representing the half of the sky, why to ignore them? And make sure that violence against women are stopped. Making sure that we invest on girls' education. Making sure that we create opportunity for women. That is so critical in the prevention programs. Is for me key. And the third one is the human rights issues I was talking about since I was starting. So I think that will help us to bring a proper prevention revolution. And we can start that already, like I said, in Shanghai, in all the big cities. Why not to say that by 2015 we don't want new infection in Sydney? Why not? You have been able to almost stabilize, reduce the number of infections. You have been controlling through all your prevention. Let us say Sydney will be one of the countries, cities with a zero new infection. Is part of a dream I want to be seeing, you know. And the second change is the change on a treatment paradigm. To be honest with you, what I am saying today is not sustainable. I'm seeing a limit on whatever we are doing. The costs are rising. We are moving from an approach which is based on molecule 1, molecule 2, molecule 3, molecule 4. Even countries like Brazil, who have been introducing what we call a constitutional law to make treatment free for all the people in need, they are already in rescue mode because they are having more than 1,000 people on molecule line 3 of treatment version 3, which is costing almost $19,000. So coming from high, we went to low, and we are going back to high. It's not sustainable for no countries. So it's important for us, and that's why in Vienna, I call for treatment 2.0. Because this treatment 2.0 means what? It means a simplified treatment. It means a simpler drugs, which can be certainly giving less resistance. It could be more resilience on resistance, which you can administrate for longer time, not just for 4 years, 3 years, 5 years, and then moving to another mode of treatment. But which can be also administered by a less complex health system, community worker, others. So we make it less difficult for the people to own their own approach. So it is for me the way to democratize the problem solving, making sure that the people can be able themselves to own a little bit this treatment approach. And also it will help us, if we manage to reduce the cost, to have a combined molecule, to bring a big pharma and others in the game. It will help us to save, to expand the coverage first, and to reduce the number, and I said the number of deaths by almost 10 million from now to 2025. And it will help us to avert certainly the 1 million new infection every year. If we manage with this less costly approach, more easy to manage to reach the people in need of treatment, that could be bringing a big change. The other things I personally feel which is very important for us is to start thinking about sustainability. I came from Papua. Almost 100% of people who are on treatment based on resources coming from outside. So, and it's not just Papua. In Africa, you have 95% of the people on treatment are there on treatment based on resources coming from two sources, Global Fund and PEPFAR in majority. So we have to change completely the paradigm. It's important now also to start thinking about shared responsibility, to start making sure that mutual accountability, to start helping the countries to have what I'm calling sustainability transition plan, to make sure that they will not be just people you are putting on treatment, will not be on treatment based only on one source of financing. It's obliged us to start thinking about also innovative financing mechanism, more sustainable funding, more predictable funding. It's making me so scared. And also I know Michel Kajashkin probably address you here. But, to have a fund to every 2 years, to come for getting replenishment and not knowing if you will have money, and knowing that you have a responsibility, moral responsibility, because you put millions of people on treatment out there, and you know that their life are hanging in the balance, as will depend of goodwill of key donors. It's very difficult. So I think for me is a time to also believe that no one alone can be able to resolve any global emerging issues today. We saw that with financial crisis. We are seeing that with climate change. We are seeing that with many others. We need a shared responsibility. We need to use again this opportunity of AIDS to change the paradigms of development relationship, bringing more mutual accountability. That doesn't mean that we are saying that Mali will be able to pay everything tomorrow morning, but it's important. If I am president or prime minister of Mali, when I am putting a Malian on treatment, and I know that those people will be on treatment for 30 years, for 20 years, for a life, I need to start thinking about from where these resources will come. Is critical and is a genuine question we need to raise. And I think lastly, this big reshaping will also help us to think about integration, taking AIDS out of isolation. Like I said since I came, it's not acceptable that the virus and the bacteria can work together to kill someone, and we are still fighting in a separate way with a TB office there and HIV clinics there and others, and we are not capable to bring a proper integration. I think that integration to deal with co-infection, TB and HIV, knowing that 500,000 deaths, which is a quarter of the total death, are due to that integration, is a missing link. It's so unacceptable that we continue to have those services in different places and not making that more cost effective. And we know that it is two diseases, but it's only one life. So it's important for us to make sure that this integration can work, and this reshaping is about that. It is also the same thing when we're talking about mother-to-child elimination. When I said that I don't want any babies, any places I'm going, I'm saying the same thing. Because I want in 2015 that we will have no baby born with HIV. And when I am saying that, it's not just for the babies. It's at the same time for keeping the mother alive. At the same time is to start linking reproductive health, continuum of care, thinking about this lady before she become infected, when the vulnerability, how to reduce risk factors which are there, violence against her, and is about also system building, is about for us is reproductive rights, is about child health. So is how we use that one as an entry point to deal with all those issues. And that will make us more cost effective. We will leverage resources which are made available to produce broader health and development outcome. And for me, that is the objective of this all reshaping. I was trying to talk about it since I've been appointed. And again, people will say that I love sharing life stories. I was in Lesotho, and I met a young lady. She was around 21, and she was sharing her personal story, and she told me I can share it. And she was in a happy marriage. She was pregnant, and she went for her antenatal clinic visit, and she found that she was positive. She came back home, and she shared that news with her husband. She said, maybe you need to go for your test. The husband went, and the husband was negative. When the husband came back home, the first thing is that you don't stay 1 second more in this house. You have been sleeping around. I don't want this baby to come in this world. I want you to go for abortion, and I will do whatever I can. And so this happy marriage became for her a torture, a tragedy, suddenly. And of course, she left. She met mother-to-mother group, and they helped her to have access to services. And she got the baby, and the baby was negative. And I saw the baby, and I was very happy. But she was still crying, because she told me, I'm missing my husband. I love him. And I know he never gave me time to even talk. And I would have loved to have him here with my baby, because I know I never had extramarital relationship. Never. But I remember when I was 15, I was raped with my teacher. Maybe she was HIV positive from that day, and she was not knowing her status. She discovered her status because she was pregnant, because she went for this test. Those are the type of situation we are all facing, and there are certainly multiple of those situations out there, but they are all in some way telling us that what we are doing is important to continue to do it. And I want to thank you and say again how much I appreciate the work your country is doing, the leadership of your country, and I hope the 0.5% you have been announcing to reach for the ODA will be happening with government you will have soon. And I am sure, that for the replenishment of the global fund, you will be an advocate for me to continue to make this message heard by your leaders and your politicians. And I want just to end, Michael and Bill, if you allow me, by one request. This country need to remove travel restriction for people who are resident We don't need that one. This country is so respected outside as a country who is showing a leadership on human rights, and having this restriction is not needed. China remove it, USA remove it, and I'm hoping Australia will remove it soon. Thank you very much. Thank you very much. Thanks, Bill.
Well, Michel, what an amazing address. You have presented us with an incredible case, an incredible argument. It's a case for us to be proud of and optimistic about, as you called it, the leveraging effects of the HIV epidemic. But you also presented us with a case to be very worried. HIV/AIDS really globalized health issues when it emerged, and one of the things that you caution us about is that when the rich world, when the developed world suddenly gets its own HIV/AIDS problem under control, there is a very real risk that it will lose interest in this particular issue. So I thank you. I thank you for your vision. I thank you for your passion. I thank you for your humour. You've done us all a great honour to come along today and to speak with us. Thank you very much. Ladies and gentlemen, can you please join me in thanking Michel Sidib once more.